Welcome to Gut Over It, everyone. My name is Dr. Vivian Asamoah. I am a gastroenterologist in Katy, Texas, and this is Gut Over It. We are talking about an interesting GI topic every night in the month of February, and in the month of March, we're going to be launching our private Facebook group called Natural Gut Relief. I'm very excited to share that with you guys. Again, this is going to be a quick one, guys, because I had a lot of stuff going on tonight, and I still have to get back to patient charting today, actually. But this last week is our last week of Gut Over It. And this week, I want to take a minute to celebrate Black History Month and present a Black physician, scientist, or mover or shaker in the medical field who has made a lot of impact in our world today and actually made a lot of impact in my own personal life. And I want to talk about Dr. Rebecca Lee Krupler, who was actually the first African-American to earn a medical degree. So that is who we are honoring tonight, Dr. Rebecca Lee Krupler, or is it Krumpler? And just a big shout out to her impact on the African-American community and our impact in medicine in general. So today is going to be a simple discussion. I just wanted to talk about my personal experience with supplements, prescription in my practice and recommendations to patients. I'm a gastroenterologist, but I'm also a functional medicine provider. We use a lot of integrative holistic medicine. We try and always use natural supplements first and food as medicine at all times. And we try and make sure that we are using natural supplements or food as medicine as the first go-to for every patient that we see. We will prescribe prescription medication when we need to prescribe prescription medication, but we always try and see if we can change things through someone's diet. So there are a couple of key supplements that I think everyone needs day to day, and that I've noticed that when I check the levels, they're always really low. And so I make it a standard at all my patients to put them on vitamin D. And you want to make sure that you're on vitamin D with vitamin K. This is what I take every day, 5,000 units a day. You want to check your levels at least once a day. Why? Because vitamin D has been found to be an extremely important natural supplement in our body. It is not only important for bone development and calcium absorption. We know vitamin D to almost function as a hormone, as an enzyme, intracellularly in the mitochondria as part of metabolism. Studies have shown that vitamin D decreases, of course, cancer risk, right? Cardiovascular issues, liver disease risk. Even from a hormonal standpoint, thyroid issues. So vitamin D is proving to be a very, very critical micronutrient that we must always replete. So I take a vitamin D with K because vitamin D needs vitamin K to be well absorbed. I take 5,000 units every day. I check my levels every year, and actually twice a year. And if I need to take more, I get the prescription dose of vitamin D3. The second prescription supplement that I take, and I always make sure it's a very good quality, is omega fish oil. Omega fish oil is extremely important in helping build the barriers, the lining of the gut, the lining of the brain. It's extremely important in helping with fatty acid metabolism and getting cholesterol down. It's great for the skin. It's great for children's development in general. Omega fish oil I also give to my family. I make sure I get a good source, right? So make sure you know where you're getting your supplements from. And that's why we use very, very good supplement companies. We just don't buy what's over the counter, because very often a lot of people will come in and say, oh, I take one pill a day. But when you look at the studies, and this is what we try and do at our practice, is we prescribe not what's on the bottle, but we prescribe what the scientific evidence is behind a particular supplement, right? So omega fish oil, we know that you need at least 2.4 to 3 grams a day for it to really have the benefits. So we make sure that patients are actually using that quantity, and we make sure that the quality is good. So vitamin D, fish oil, absolute must. A lot of patients come in and ask me, should I use a multivitamin? That's a loaded question. One, where are you getting the multivitamin from? So sources are important, right? Just the over-the-counter stuff at Walmart, at CVS, you got to be careful. There are a lot of fillers. There's a lot of stuff like silicone dioxide. There are a lot of colorants to make it taste better. those could be, you could develop sensitivities to that, or you could have sensitivities to those. So the question one is, where do I get that multivitamin from? What is in that multivitamin, right? Making sure you're not taking a multivitamin that's going to cause symptom. And then the second thing is, do I need that multivitamin? So in this era of medicine, in terms of personalized care, we actually know that the same multivitamin that may be good for one person is not necessarily what another person needs. So the whole marketing concept of, multivitamin for over 60s, multivitamin for, 50-year-old women, I think it's more complex than that. I think everyone comes with their own genetics. Everyone is influenced by their own epigenetics, their family history, and the multivitamin or the vitamins or the micronutrients your body needs is going to be completely different to what somebody else needs. So I'm not a fan of daily multivitamins unless I have actually done a detailed micronutrient test. And these tests exist. There are very good companies that do detailed micronutrient tests where they measure every single vitamin from vitamin A to the B1, B2, B6. They measure your antioxidant vitamins, your vitamin C, your vitamin A, your iron, your D. They measure and see what markers of oxidative stress look like, markers of methylation look like. And from that, we then deduce and say what you need. And some of the multivitamins out there don't contain everything that you need. They are missing oxidative protective factors that your body may need. So in today's day and age, if you're really focused on healthy living, wholesome, healthy living, natural living, and avoiding toxins in your systems and making sure you're taking what is right for you, then you should definitely do a micronutrient test at least once a year. We have a lot of athletes that come in and do this test. We have people with autoimmune disease that do this test because they realize that their need for micronutrient is maybe totally different to what an over-the-counter multivitamin is offering. So I would recommend a micronutrient test, and then determine the right type of multivitamin for you. When it comes to multivitamin choices or even supplement choices, I do not advise any gummy supplements. I do not advise any colored supplements or supplements that have alcohol contents in them, because a lot of people are sensitive to those. The guar gum can be troublesome for a lot of patients in terms of GI symptoms. So really try and go as naturally as you possibly can. Let's see, in terms of probiotics, a lot of people say, hey, Dr. B, do you take a probiotic? I only take a probiotic in an acute set, like if I just got a nasty gastroenteritis, I got a bug, and I had to take antibiotics. At that point, I would take a probiotic for a post-infectious issue that I had. But I do not take a probiotic on a daily basis. I am not sure there is benefit to taking a probiotic on a daily basis when you have a healthy diet. As I tell my patients, I don't know if it's worth taking a probiotic every day and buying an expensive probiotic when you're constantly eating processed food and you have like a huge bag of French fries and you just finished a burger. I don't know what the probiotic is going to do for you. So what we like to discuss with our patients is focus on the diet, use food as medicine. The foods are rich in prebiotics and probiotics. You do not need to take a probiotic every day. Now, there are certain categories of patients that I will recommend probiotics to. Some of my patients have severe constipation, and I'll find that probiotics help. After they've used antibiotics, as I said, after they have gotten over a parasitic or bacterial infection. And then if they have bacterial overgrowth or fungal overgrowth, and I'm trying to repopulate the gut microbiome, at that point, I will use a probiotic, but for a specific duration of time, about 90 days, and I may cycle it, and that's how I use my probiotics. But I don't use probiotics every day, all the time. If you're needing a probiotics because you're having issues without the probiotics, then let's try and identify what those issues are. One more thing that as a gastroenterologist, I prescribe quite a lot in my practice, I would probably say glutamine, high dose glutamine. And this is amino acid. You can find it's an excellent amino acid to help heal the lining of the gut. And I will use glutamine when patients are in the recovery phase of gut healing. And so it's usually in a powder form. If you look at the research, the doses needed of glutamine are extremely high. And we probably are underdosing when we just give, the normal serving. So I usually double or triple the servings of glutamine in my patient because I'm really trying to follow sort of the science behind the use of these supplements and make sure they're getting exactly what they need. Over supplementation is an issue. So too many supplements can cause issues. I've worked with certain providers in the past who have prescribed 30 to 40 supplements. Then you don't even know what's working. And this can cause long-term issues in terms of side effects. So too many supplements is an issue. You want to kind of rotate your supplements depending on what stage you are in the gut healing process and what you're working on. So avoid too many supplements. It can be an issue. It can cause gastritis, just like aspirin or NSAIDs would. So again, that's kind of like our philosophy at our practice. We like to use evidence-based medicine to practice our integrative functional medicine, making sure we're giving the patients the right micronutrients, using food as medicine at all times. But I will say, if there were 2 supplements to be on all the time and that have been clearly shown to have benefit in terms of prevention and risk reduction of inflammation, cancer, and other things in the body, then I would definitely say vitamin D and omega fish oil are my go-to. I hope this was helpful. Short evening tonight. I'll have to think of a topic tomorrow night. I want to again mention Dr. Rebecca Lee Krupler, the first African-American female to earn a medical degree in honor of Black History Month. Have a wonderful evening, guys, and I will see you tomorrow at 9 p.m. Take care.